अस्सलाम वालेकुम या कनाब्दु या कनस्ताइन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो में मेडिसन 21 फरवरी मॉर्निंग का पेपर मैं करने जा रहा हूँ। सो लेट्स स्टार्ट। क्वेश्चन नंबर 1, व्हाट इज़ एक्स लिंक्ड डिजीज़ Duchenne's muscular dystrophy. Question number 2, HLA-B27 is associated with ankylosing spondylitis. Question number 3, right optic tract lesion cause vision loss, right nasal and the left temporal, myasthenia gravis bilateral ptosis at night. What test will help in the diagnosis? That is acetylcholine receptor antibodies. Myasthenia gravis shows which type of hypersensitivity, that is the type 2. Emergency department protocol is that is only patient is allowed inside the medial portion of the frontal and the parietal lobe. Blood supply is ACA. The for transplant best cell for the typing is the white blood cell. The 28-year-old soldier returning from the Siachen have spent 6 hours and present in the CMH Ravla code with complaints of headache and the peripheral cyanosis of his most probably the cause is the secondary polycythemia. The patient had the RTA. He does know recent events to remembers his school. He does not know the recent events, and this is the damage of the hippocampus. Which one cause a lung carcinoma? That is radon. The patient had low respiratory tract infection for many days on histology. Respiratory tree, which of the following will be damaged? Celia, 50 years old post-menopausal woman having hot flushes. Cause is increased FSH luteinizing hormone. The patient using steroid for very long time. He is at the risk of hypokalemia. Which one involved in acute inflammation? That is the neutrophils. A man with the 4 hours MI died due to which of the following? The arrhythmias. AV nodal delay results in the prolonged PR interval. Next, the middle diastolic murmur, pulmonary hypertension, the pulmonary edema. Which of the following patient will most likely develop? That is the right ventricular hypertrophy. The density of the CSF is 1.0005. Adenocortex derived from the mesoderm. The 2-month baby caused loose motion after every feed immediately due to the gastrocolic reflex. The 1-year-old child presented the diarrhea after 1 year history of the some milk intake is given by the mother. Doctor asked her to stop giving milk to baby. The cause will be the lactose intolerance. The young lady has the gallstones which has caused blockage of the bile duct. This will lead to the increased fat contents of the stool, which when temperature of the skin reaches 52 degree, which receptors are stimulated? The nociceptors, and the posterior 1/3 interventricular septum is supplied by the RC. HIV effects. Which of the following cells? Helper T cell first line against the viral cells is the NK cells. Vitamin B12 absorption need. Which one of the following? That is the intrinsic factor. 30-year-old female presented the acute chest pain and the hemoptysis 1 week after delivery. There is no fever. It shows S1Q3 tube pattern. This is definitely the CT angiogram. The next, this is the scenario of the pulmonary embolism. Next, the child playing jungle lion game, he got goosebumps. Which mechanism? The constriction of rectopili muscle. The coagulation of the blood in vitro can be prevented by using the heparin. The patient of meningitis was given treatment after a few weeks, presented with the morning headache and the papilledema. The hydrocephalus. The patient's intestine does not get back to the diagnosis. Would be the omphalocele. The spina bifida occurs due to the deficiency of the folate. The superior rectal artery is the branch of which of the following artery? That is the inferior mesenteric artery. The allograft is from same species. In female of the cancer taking radiation, it will affect which system? That is the hematopoietic system. Most radiosensitive tumor is of the lymph node. Next, highest conduction velocity in the Purkinje is due to the less number of the myofibrils. The striated muscles that rhythmically myogenically contract in synchronized fashion is the cardiac muscle. The upper and the lower limits of cerebral blood flow auto-regulation would be 50 to 150 ml/minute. The urea form in the liver. 30 years old man with a sore throat and cervical lymphadenopathy. CBC picture shows the presence of the typical lymphocytes. This is the monospot test. Ball hit the anterior thigh. There will be damage to the profunda femoris after RTA. The patient has surgical fracture of the neck of the humerus. This will lead to the damage of axis nerve. After clavicular fracture, the patient is unable to perform lateral rotation of the arm. The muscle involved with the TD is minor. The patient, the artery, has the severe blood loss and no urine output even after 3 days. Patient failed to have the urine output. Creatinine 9.5. Biopsy shows the cortical necrosis in the sphere acute tubular necrosis, which is the cause in this patient? That is the irreversible injury. The man has noticed the scleral icterus for the 4 days. Malaise for 1 month. Examination tachycardia and the vitals normal. The physical examination unremarkable. Lab findings show hematocrit 25%. This is the intravascular hemolysis. The glomerulus is formed by the afferent arteriole. The bone marrow tap of the patient with the ITP shows increased myokaryocytes in the bone marrow. The hypoxemia in the blood is sensed by the carotid bud. The patient of asthma having the following ABGs. This is basically the scenario of respiratory acidosis. In the liver cell injury, enzyme decreased is the pseudocholinesterase. The shortest acting benzodiazepine is the midazolam. The cystic series caused by which of these parasites is ingestion of the ova of the tinea solium. The woman with the history of the trauma to the head and neck region having the lesion on the tongue, on the protrusion of tongue deviated to the left side. The nerve most likely involved with the left hypoglossal. The P waves more than QRS complexes are seen. The arrhythmias about exercise action potential. What is true, that is the action potential is generated with an increase in the extracellular potassium. The hemoglobin accept protons. HB is a proton from which amino acid, so that HP can act as the buffer. The histidine after marathon race, a person loses 2 liters of sweating, he drinks 2 liters of water. What will happen? The decreased osmolarity of the ECF angiotensin to shortest function is the artery vasoconstriction. Regarding the bronchial asthma, the most probable finding will be the FEV into FVC ratio less than 75%. That space isn't affected by the shallow breathing. Woman, the RT was brought to the emergency where she was intubated and transfused blood. After a few days, the HB got down from 12 to 8. On endoscopy, gastritis and the gastric ulcer were found. What is the reason behind the gastritis? The bicarb and the chloride shift. Arterial bronchus supplies to the right superior lobe. A semi-conscious patient aspirate while lying on his back. The segment of lung most likely affected the apical segment of the right lower lobe. Left lower lobe differentiated from the right upper lobe by not having the apical segment. Thiazide diuretics act on the early DCT. The 46-year-old male presented with the nephrotic syndrome. Immunofluorescence microscopy biopsy shows the sclero in the deposition of IgM. Which of the following is the diagnosis? That is the focal segmental glomerulosclerosis. Next, the 70th part of nephron affected mostly by the ischemia is the PCD. The patient presents a sore throat, the membrane coming the throat, won't remove the membrane, bleeds. There is a diphtheria. The female, the history of itching, jaundice, xanthoma, and the hepatosplenomegaly required investigation for the diagnosis. The anti-mitochondrial antibodies. Patient having recurrent UTIs. On culture, green colony fruity smell. Which drug is used? The ciprofloxacin. The high output cardiac failure is found in the vitamin B1 deficiency. Next, epinephrine is not given in the hypertension. The patient with already taking amitriptyline. Which of the following drug used for the pain management? Acute pancreatitis. The pethidine. The HIV positive patient with the history of here's the vomiting. Glucose is less. CSF glucose is less. Proteins 45. It is the herpes encephalitis. This metidine interaction with the warfarin decrease hepatic clearance. Warfarin. Which of the following is the histamine blocker? That is the cimetidine. The uncoupling oxidative phosphorylation, that is thyroxine. Next, the Regenerative muscular dystrophy defective gene makes the cell impermeable to which of the following? The protein. The patient presented with the history of arthritis, urinary problem, HLA B27 positive, that is the Reiter syndrome. Lesion at right optic tract results in the left homonymous heminopia. Stage 4 CA cervix drain. Which lymph node? Internal iliac and external iliac. The patient present the ER with the GCS. This one, the part of brain affected will be the temporal lobe. Next is the following cause bladder carcinoma, that is the smoking. The patient is having rhinosinusitis, nasal polyp invading the lenum papyracea, excessive endothelial damage, and having non-separate hyphae. Organism involved would be the mucor. The dental patient on the steroid went to surgeon when he what will be the first treated? That is the hypoglycemia. The patient with the wound having yellow discharge. Which one is related? The neutrophils. The patient having xerostomia, likely nucleus involved would be the spurious elevated nucleus. The plasma protein drug related the inactive until activated by the liver cancer, most prevalent in the male of the Karachi, that is the oral cancer. The acute mastocytosis caused by which bacteria? The Streptococcus pneumonia. Girl with the coarse facial features, gap between the incisors and spade like hands. What the muscle involved? The disease is the alignment. The patient is known case of migraine. Is the aura falling apophylaxis of migraine given to this the patient. The propranolol. The old man died after 4 years of RT. Is having the femur fracture. Upon autopsy, he was having the pulmonary infarcts and vessels were occluded by the hematopoietic stem cell origin cells, that is the fat embolism. Next, the patient with the history of the Sweat degree burn cause damage of spinous granulosum, and Bezalis effect will be the cutaneous water loss, the edema, flood due to the inflammation, exudate. Side effects of the recombinant human growth hormone include the benign intracranial hypertension, the twin pregnancy with two ova which is correct, that is a separate amniotic sac. Separate amniotic sac cross bridge in the skeletal muscle is formed by the myosin. The HIV patients, immunocompromised patient, the profuse diarrhea. Resistance shows the oocyte 4 to 6, that is the Cryptosporidium parvum. Basal bodies are formed by the centrioles. Incidence is defined as the number of new cases over a period of time. The spasticity occurred due to the lesion of the pyramidal tract decebration. What required for the muscle contraction, that is the stretch. 30-year-old female with the fever, headache, ptosis, Mydriasis, isochronic bilateral horizontal diplopia nerve involved with the oculomotor nerve. The pregnant lady give history of alcohol consumption in the first trimester. Her baby was at the risk of developing the premature birth. Young man present the complainant low grade fever, generalized weakness, backing, swelling the front of thigh. Examination here, swelling above and below the inguinal ligament which disappears in the lying down. Diagnosis, that is the psoas abscess. The patient undergoing the thyroidectomy at the upper lobe of the nerve likely to be injured in the vicinity of superior thyroid artery is the external laryngeal nerve. Next, the beta cell marker used for the identification in the tumor is the CD1920. 40-year-old lady presents with the hepatosplenomegaly, pruritus, and Thilisma in the jaundice for the last 3 months. Most appropriate, that is the AMA. Antimicrobial for the amoebic liver abscess is the tinidazole. The drug contraindicated in the CLD is the pentazocine. The patient has the CVA now has the zero power in muscles. The following sensory receptors are not functioning in this patient: the nociceptors, and the esophagus in the thoracic area is constricted due to the arch of the aorta. The ligament piercing at the last during the epidural would be the ligamentum flavum. Next, the antigen process by the exogenous epitope present pathways are presented with the following, that is the MSC class 2. Next, the antigen presenting Th1 present the antigen with the CD8. The MSC function is the immune recognition. Male and the female patient diving into group, the subgroups. Which type of the sampling is that? Stratified random sampling. The confidentiality can be breached only if the patient allows you the patient after history of develops the brain necrosis. Ischemia, which type of necrosis is seen, that is the liquefactive necrosis. They diminished jaw jerk due to the lesion of the mesencephalic nucleus of the fifth nerve. The hearing improves in noisy environment due to the following condition, that is the otosclerosis. The structure found 2 feet away from the ileocecal junction at antimesenteric border is most likely the Meckel's diverticulum aspirin. The lower doses inhibit the following: inhibit the thromboxane to female patient with the bilateral pleurophy, the dyspnea, and the having pedal edema, that is going to be CHF. The second order neurons of the anterior spinothalamic tract lies in the substantia gelatinosa. Next, which anti-HIV drug cause pancreatitis and the peripheral neuropathy, that is the danosine. Which valves are most commonly involved? The rheumatic heart disease, the mitral and the aortic. The management of DVT in the woman with the leg pain and the swelling is the Loprine and the warfarin. The calculate alveolar ventilation when the tidal volume is 500, respiratory rate is 10, that is Charlie 3500. Next, the EEG of the patient shows no A waves because the patient is alert and the conscious. Event occurred just before opening of aortic valve, the beginning of the systole. On ECG of the girl, you will see the tooth waves with the P wave in the ratio of 3:1. There is a flutter mechanism of action of the insulin is the inhibit the glucose inside the cell. Which the following is the panaplastic syndrome. The small cell carcinoma tumor with a good prognosis is the gastric 55-year-old male with a past history of gastric pain for which he was taking antacids, was diagnosed as a gastric lymphoma. What is the most likely diagnosis? That is the H. pylori. Next, 46-year-old male present with the nephrotic and immunofluorescence microscope of the renal shows sclerosis with deposition of IgM and the C3. There is a focal segmental glomulosclerosis. Focal segmental glomulosclerosis is the massive proteinuria. Which of the following is used to calculate total body water? That is the heavy water. White blood cells enter lymph node through subcapsular afferent lymphatics. During excessive blood loss remains unchanged to the brain. Inspiratory RAM signal produced from the dorsal respiratory neuron. The rate increase response to the impulses from the pneumotaxic center in the pons. Which of the following occurs due to the sympathetic stimulation? That is the bronchodilation. The patient has the lipoma on the posterior aspect of SCM 5 cm relation to sternoclavicular joint, which structure ligated leading to the profuse bleeding. That is second part of the subclavian. Child with the hepatosplenomegaly, streaks on hair in the face abdomen protruded, cause the kwashiorkor. The girl with the recurrent staph abscess also had the 2 bouts of aspergillus. The cause is the NADPH deficiency. The 60-year-old developed pain in the calf muscles after walking 100 yards. The pain is due to the popliteal artery. Next, the esophageal granules contain the actinomycetes. Next, 153. The 15-year garden. The history of the chest pain. No other symptoms X-ray was done, which showed the round mass which is calcified. The aspergillus pulmonary vasoconstriction occurs due to the hypoxia. Pulmonary vascular resistance of infant is similar to adult, at which age there is the 1 week. The Fanconi syndrome decrease ATP at the PCD linked with the glycosuria. The mesangial cells have the contractile property which helps them to maintain the renal blood flow. The hemoglobin saturation increase, which is the following condition. The increased partial pressure of oxygen. Wound contraction is the function of the myofibroblast. The patient is suffering from the pseudomonas aeruginosa infection. The fever which actually converts in the kind of infection, that is the TNF. 80-year-old cardiac patient has the shortness of breath, progressively orthopnea with the pleural fee and tabazon, which factors are the transitive or exudative. There is a low cell count. Which of the following systemic factor is responsible for the poor wound healing, that is the diabetes. Embolus is large in the renal artery. Now this is the scenario leading towards the coagulative necrosis. Next, transformation of macrophages, the diploid cells in the chronic rheumatis is mainly brought about by the following, that is the interferon gamma. A poorly patient presents the hemorrhage near the follicles, petechia, bruises, and the mucosal lesion, which poorly healing decreased collagen deficiency. Which of the following, that is the fibroblast. The patient has the malaise and fainting. Fatigue has decreased vascular platelets, specific neutrophils. All of these decrease, but which of the following will not decrease? There is a T lymphocytes in an experiment. A scientist treat a group of mice with anti-serum with a substantial depletes the number of circulating neutrophils. This is the scenario leading towards the acquired immunity. 168. The most common cause of squamous cell carcinoma is the Bowen disease. The patient presents the chorea, mental retardation, depression, and the memory loss. The mode of inheritance of the disease would be autosomal dominant. Next, 170. The patient's CHF is worsening. The cause would be the sodium and the water retention. Atherosclerosis plaque, which is the following 3 found. That is smooth muscle, extracellular matrix, intracellular matrix, and the lipids. Next, 172. The granulation of the basophils in the mast cells cause which kind of the shock? That is the anaphylactic shock. An IV drug uses most common involved organism will cause which infection? There is infective endocarditis. Which of the following is seen? The ankylosing spondylitis, aortic insufficiency, Escobar body generation. Initial stage is the febrile degenerations. The baroreceptors maintain mean arterial pressure. Patient the wheezing, nasal congestion, runny nose, and fever. Biopsy of nasal mucosa shows the degranulation of the mast cells. Next, 178. The woman deliver a baby, the cleft palate and the congenital defects. The drug will most likely leading the retinoic acid, the basal ganglia substantia agra leaves. But to stop the seizures, that is the GABA. Cetolizole produce which to inhibit FSH, that is the inhibin inhibitory spherocytosis defective protein.